Hello, and welcome to Module 1 of the CES Evaluating Impact training programme. This is the first module in a 4-part series designed to support organisations that want to demonstrate the difference they are making to build their evaluation capacity. Each module is packaged individually, so you can choose to attend 1, 2, 3, or all 4, depending on your experience and needs. Before we get started, here's a quick overview of the full programme. Module 1. Evaluating Impact, an Introduction. Module 1 introduces the essentials of evaluation, including how to define outcomes and outputs, understanding your theory of change, and identifying indicators of success. It's ideal for those new to evaluation or looking to strengthen their foundational understanding. Module 2. The Nuts and Bolts of Evaluation. In this module, we'll build on the basics by exploring how to gather the right data, choose appropriate evaluation methods, and develop a practical evaluation plan. It's suited to those who already understand outcomes and indicators and are ready to plan and implement evaluation activities. Module 3. Making meaning from your data. This module focuses on analysing your data. It's perfect for those responsible for quantitative or qualitative data analysis and drawing out insights for demonstrating impact and informing policy and practice development. Module 4. Telling the story of your data. Module 4 will be of interest to those who want to build a communications plan that will tell the story of their impact for a range of audiences and purposes. It will examine the who, how, what, why, and when of telling a compelling story. All modules are available as self-paced online sessions. If you have any queries about this training or would like to speak to a member of the training team, please feel free to get in touch with us using the email included on the slide. CES is an all-island, not-for-profit organisation. As you can see, our work is diverse, ranging from research and evaluation, making evidence usable for a range of practitioners and policymakers, building the capacity of other organisations to do the same, and supporting shared learning experiences. Our purpose is to improve the lives of people on the island of Ireland by supporting the implementation of excellent public services through evidence-informed policy and practice. Our vision is to be a trusted partner in the design, development, implementation, and evaluation of public policies and services across the statutory and voluntary and community sectors. In Module 1, we will look at the essential foundations of your evaluation. We will begin with outcomes and outputs. What are they and why do they matter? We will explore the if-then relationships that help you to see the links between what you do and the difference it makes. Finally, we will focus on how you can demonstrate that your service, programme, or policy is working. What would be the indicators of success? By the end of Module 1, we anticipate you will have the ability to identify outputs, outcomes, and indicators of success for your service, and develop a theory of change of your service. Don't worry if you aren't familiar with these terms. We will explore them in detail and give you time to practice. What is evaluation? Evaluation is a planned investigation of a project, programme, or policy according to specific questions of interest. It is carried out in a systematic and robust way using reliable social scientific methods, which are covered in Modules 2 and 3. The results can tell you what works, what doesn't work, how things can be improved, and if it's value for money. This is the evaluation cycle we've used to shape these training modules. It starts with deciding the purpose of your evaluation, in other words, what information you need and why it matters. We will touch on that in Module 1 and develop it further in Module 2. In this module, you will learn how to develop a theory of change for your service. A theory of change helps you clearly describe the outcomes you're aiming for, the steps or changes that lead to those outcomes, and the indicators you'll use to evidence your service contribution to those outcomes. Once your theory of change is clear, the next step is designing the evaluation, which is the focus of Module 2. This means deciding what information you need for your purposes, how you'll collect it, for example through surveys or interviews, and who will be involved and when will it happen. In Module 3, you will focus on analysing your quantitative and qualitative data. The fourth and final module will guide you through reporting data effectively and telling the story of your impact and learning. We are often, understandably, focused on providing data to our funders that demonstrate the value of a program or service. But a lot of time and effort goes into good evaluation practice, so we believe that you should be able to use it for your own purposes and not just for your funders. Evaluation data can support decision-making and planning. It can help you to critically assess the performance of a program, service, or team and identify where to focus your quality improvement efforts. Finally, it can help you to develop your knowledge and understanding of what works, for whom, and in what circumstances. You can build an evidence base that you can share with others in the sector or to influence government policy. The foundation of your evaluation is your theory of change. But what is it? When we talk about the theory of change for your service, we are talking about your theory of how things you do every day will help make the difference you are hoping for. It is the hypothesis or explanation of why you believe it will work. The theory of change maps out what you are putting into your service, for example, people and resources, what your service is going to do or produce, for example, training, one-to-one support, or a public health campaign, and what changes you expect to see as a result. A theory of change can be used in designing, planning, implementing, and evaluating a service. It helps make sure your evaluation is grounded in a clear understanding of how the program works. How do you know what to measure if you haven't identified your activities and products and how they will affect the changes you want to see? The theory of change can even be developed after the program has finished, especially if you're evaluating retrospectively. A theory of change is not a static thing. It is dynamic and will need to be reviewed as your project develops. You might need to update it, fill in gaps, or adjust it based on how things have actually played out. We will begin by defining some of the core elements in your theory of change. Inputs are the resources you have to invest in your service or program. They can include the resources used to create your innovation or product, financial, physical, human, and technological resources, and support structures. Outputs are the activities that you do and products you create with your inputs. When constructing a theory of change, you will want to think about the size, amount, frequency, and/or reach of the activities and products. For example, we will provide a 4-module training course to groups of 12 adults in rural counties Fermanagh and Tyrone twice a year. Outcomes describe the difference you expect to see as a result. These could include positive or negative changes in individuals, communities, or at a systematic level. We will talk more about that later. The foundation of your theory of change is the if-then relationship. The if-then relationship is the link between the different steps along the journey, from getting the funds to realizing your desired outcomes. If we do A, then we expect B to happen as a consequence, and if that happens, then we expect the next step, C, to be achieved. If-then relationships should be based on evidence. We are not wishing for these causal relationships, we are expecting them, based on evidence or previous experience. It is also important to understand how the change is going to happen. Is it, for example, because people will be better informed through an awareness-raising campaign, or be less isolated through opportunities for peer support, or have increased skills through training? Let's look at an example to make this clearer. An organization might make the claim that if they could only get the funding, they could make a serious contribution towards mitigating climate change. But the funder wants to know the detail of the how. Let's look at a simple example. Why should the government invest in wind farms? This series of if-then relationships breaks down the stages and makes clear the journey from the input, the funding, through to short, medium, and long-term outcomes. So if funding is provided for wind energy projects, then wind farms can be constructed. And if wind farms can be constructed, then clean energy can be generated. Note that the generation of wind energy is not an outcome, it is an output, something produced. If clean energy can be generated, then reliance on energy from fossil fuels will be reduced. And if reliance on energy from fossil fuels is reduced, then less carbon dioxide will be released. And if less carbon dioxide is released, then climate change will be mitigated. You can see in the diagram that we move from inputs to two sets of outputs, to short, medium, and long-term outcomes. In this second example, we look at why the government should invest in individual tutoring for children not meeting their educational milestones. If funding is provided for a tutoring program, then tutoring can be provided for 3 hours per week for 1 school year. And if tutoring is provided for 3 hours per week for 1 school year, then 50 students will receive individual learning support. And if individual learning support is provided for these 50 students, then they will learn and improve their skills. And if they learn and improve their skills, then they will get better grades. And if they get better grades, then they will have improved educational outcomes and beyond. We recognize that both of these examples are simplistic and linear, with all sorts of things that can interrupt the if-then relationship. We will address that as we go through Module 1. To apply this learning to your own work, please take 10 minutes to think about the if-then relationships that make up an area of your work. Hopefully you have identified a project, policy, or program that you want to focus on during the training. If not, take the time now to think about that. We will continue to work through your live example so you have something useful at the end. For this activity, remember it's not just a list of actions. Try to think about the relationship between the different elements and the movement from what you are putting in through to what you can then do and to what changes you expect to see as a result. Please pause the recording here and open the workbook for Module 1. Template 1 in your workbook will help you in this activity. Don't worry if you don't fill in all the boxes. The main thing is to get used to thinking in terms of understanding the relationship between what you do and what will change as a result. In reality, you would have quite a few sets of if-then relationships in your work. You can resume the presentation when you have completed the activity. As mentioned before, the if-then relationship can look a bit linear, a bit simplistic. Change doesn't just happen by magic. It is helpful to understand the rationale behind why you think the change will happen. Is it, for example, because people are more aware, have been upskilled, or are better connected? We know that change doesn't just happen because of a great program of work, but when a great program of work is implemented well. There are conditions that are required for your if-then relationships to work out as you had hoped, and there are assumptions you might make about those conditions being in place. It is important to take into consideration what may need to change for your theory of change to be successful in reality. These could relate to, for example, resources, availability of the right people, your reach, or your skill levels. Please pause the recording here and open the workbook for Module 1. Take some time to think about a couple of the connections in the if-then relationships you identified in the last activity. Can you identify the because, how the changes will happen, and the so long as, what is required to make the if-then relationship work? Template 2 will help you to do this. Hopefully you found it useful to think about how you might want to plan for the implementation of your work to support your theory of change. In CES, we usually present our theories of change in this form, as a logic model. The logic model tells the story of your project on a page. We will go through each of the component parts during the rest of the training and give you the opportunity to build a logic model for your project, policy, or program of work. When we present the story of your project on a page, it will start with why you are doing the work. That's the situation analysis. Then it will deal with what resources you have. Those are your inputs. Followed by what you will do with these resources and what you will achieve. Finally, it will tell the reader what difference that will make and how you will know. But when we are putting it together, we do it in a different order. Before we dive in, we are going to spend a few moments on the process and benefits of developing a logic model. When using the logic modeling process to design or review a service, step 1 is identifying the problem or opportunity that you are addressing, the situation analysis. An important element of developing the logic model is that you then think about what you want to be different about this situation, not jumping straight into what you are going to do about it. Step 2 is, how do you want things to be different? What specific changes do you want to see? It is only then that you start to plan what you will do that will bring about these changes. That's step 3. This method opens up the potential for innovation and researching different options for achieving your goals. Once you have agreed on your planned activities, you need to check that there is a strong theory of change between what you will do and what you hope will change as a result. That's step 4. At step 5, you will think about what you can measure. What will these changes look like for your target population? These are the indicators of change. Finally, we identify the resources you have or will need to do this work. This process can be used to design a new service or to describe or review an existing one. It supports the process of building an evaluation plan, communicating with stakeholders, and planning for implementing your service effectively. Your theory of change is only as good as its implementation. Thinking a little bit more about how you can use your theory of change to support your implementation planning. Remember we talked about the if, then, because, so long as relationship. Including strategies for how you will manage the so long as factors will strengthen the likelihood of your theory of change succeeding. Ask yourself, what are the barriers that could hinder or interrupt the if-then relationship that I need to address? And what would support or enable the if-then relationship that I can build on? If we think about the tutoring example from before, we are assuming we can hire a tutor with the right skills and experience. We need the teachers to get on board with the proposal and refer suitable candidates. We need parents to support their children to use the program. We are assuming children will want to attend. And we need suitable accommodation for tutoring. The absence of any of these could create conditions that will have a significant impact on your expected outcomes. Module 2 and 3 of this program will provide the input you need to build, manage, and learn from an effective evaluation plan. If you are more interested in training on good implementation practice, you are welcome to talk to us at any time. We will now go through the components of the logic model in more detail, starting with the situation analysis. The situation analysis involves taking stock of the situation or problem that you are trying to address. It is sometimes called the problem statement. It can include information about your organization's mission or vision, if it's relevant to why you have decided to address the problem described. You should provide a brief analysis of the need you are addressing. Information about the wider context in which the issue exists can also be helpful. The kinds of questions that can help prompt you to consider the situation analysis include: what is the situation and the important issues? What are the needs of your target population or group? What are the strengths and weaknesses of the current provision? Where are there gaps? What do we need to improve? What are the socio-economic influences, or what is happening in the wider policy or service environment? We are thinking here about what factors exist in the wider context that may impact positively or negatively on the target population. Your situation analysis should be proportionate to the size of the project, policy, or program. It doesn't need to be enormous, just a concise picture of the presenting problem and why you are addressing it. Don't include what you are going to do about it. That will come later. Please pause the recording here and open the workbook for Module 1. Using Template 3, the blank logic model, take some time to develop the situation analysis for your work. You can refer back to the prompt questions in the previous slide, but remember, you don't need to answer them all in order to have a good enough situation analysis. We will now look at outcomes, which seem easy but can often be confusing. Keep in mind that outcomes are not what you do or what is produced, they are the changes that happen as a result. Outcomes are intended or unintended changes that occur as a result of an intervention or policy. They can be short, medium, or long-term. The achievement of implementation outcomes supports the achievement of beneficiary outcomes. That means that an intervention or policy is likely to be more effective if it is implemented well. The clarification of desired outcomes provides a more focused approach to service design, delivery, and evaluation. Outcomes that occur at the level of individuals, families, or groups are called beneficiary outcomes. They can occur at a systems level, which might mean macro changes at the level of the education system or the health system. They can also occur at an organizational level. Sometimes, in order to achieve individual or system level changes, there needs to be a change in how the organization reaches people, facilitates change, or delivers its services. Here are some examples, but just a health check beforehand. We are not suggesting you should measure all of these outcomes. You should only collect data that you know you will use to address evaluation questions you want to know the answer to. Our best advice is to keep your evaluation proportionate to the size of your project and the resources you have. If that doesn't make sense, Module 2 can help you build an evaluation framework that meets your needs. Individual level or beneficiary outcomes are quite easy to grasp. We are thinking about how individuals or groups are better off. For example, outcomes relating to child health and development could include increase in numbers of children in a playgroup reaching key developmental milestones, improved physical and mental health and well-being of individual children. For parenting, we might think about increased parental engagement in a child's development and learning, strengthened parent-child relationship, reduced parent-child conflict. And for self-care training for practitioners, improved understanding of self-care among practitioners trained, and reduction in the level of practitioner stress and burnout within the group. Examples of system-level outcomes could include reduction in rates of reoffending, reduction in the number of people with a mental health diagnosis held in police facilities, reduction in educational achievement gaps by socioeconomic status, ethnicity, gender, or disability, reduction in mortality rates related to preventable deaths, reduction in delays for cancer treatment, and increased access to safe and affordable housing. With a good theory of change, it can be possible to see how you are making a contribution towards system-level outcomes, even if you can't measure it. Remember our earlier if-then relationships that pointed towards one small project making a contribution to mitigating climate change? Organizations sometimes need to change how they do things to position themselves well for achieving positive outcomes. For example, they may aim for more active use of local data collection to guide service design, more systematic application of evidence-based informed services, enhanced interagency collaboration, stronger data sharing agreements, improved access to and uptake of services, improved partnerships with parents and communities, and better equipped workforces of suitably qualified staff. At a more micro level, organizations of teams may need to improve systems and processes to work more effectively in order to achieve the outcomes at an individual or systems level. Examples might include enhanced use of service user feedback in service improvements, improvements in administrative or financial systems, improvements in response times or reductions in delays, improvements in how people access a service or program, and increased social media reach. Dr. Enola Proctor and her team developed these implementation outcomes in 2010 and reviewed their continued efficacy 10 years later, finding them to be still fit for purpose and widely used. We have included these outcomes because they can be very useful when you're trying to implement changes across your organization and need to track progress or work out where and why things are stalling. You may want to use all of the outcomes on the list, but typically there will be key areas that you need to focus on. So the scenario is that you are implementing a change in policy or practice, and in the very initial stages you are interested in how acceptable people find the proposal. Acceptability is key to the likelihood of engaging stakeholders in the change process. Stakeholders may find the idea acceptable, and you get good initial feedback, but you need indicators that they are signaling intention to adopt the proposal. With further exploration, stakeholders may or may not decide that the proposal is appropriate in their specific setting. They may think it's good in principle, but won't work for them or their team. Then they need to believe that it's actually feasible for them to implement the changes. This could come down to resourcing, vested interests, conflicts with other practices or policies, amongst many other factors. You may get adoption of the proposal, but then find that stakeholders or teams have taken it and amended it to fit with their way of doing things. In this, you have lost fidelity to the original model. Sometimes that's okay if the core elements are still in place, but there may be changes that need to be undertaken exactly as intended to achieve the outcomes. Unsurprisingly, the cost of implementing the proposed changes can be a challenging barrier. The final two outcomes measure the extent to which the proposal, once adopted and implemented, is becoming integrated into overall service delivery to the point where it's likely to be sustained and viewed as normal practice. At any point along this implementation continuum, there is potential for your proposed changes to falter and not achieve the beneficiary or system-level outcomes you had hoped for. We have included 2 more slides to provide additional information for those who are interested in Proctor's outcomes. In the next activity, you can take the learning from this section and think about what outcomes are most useful for your work. As a general rule, too many intended outcomes can result in confusion, too much data collection, and setting up unrealistic expectations of what you can achieve. Keep it proportionate to the scale of your project and resources available. When developing outcomes, it's useful to use words that indicate change, such as decreased, increased, developed, and improved. This limits confusion between outputs and outcomes. Continue to complete Template 3 using the two outcomes columns. You have options here. You may choose to develop short-term and longer-term outcomes. In this case, remember the if-then relationships we talked about earlier. There should be a connection between what you think you can achieve in the short and longer term. Alternatively, you might find it helpful to think about the organizational or process outcomes you need to work towards to position your service to achieve the desired beneficiary outcomes. You can just rename the columns as it suits you. The more time you give to being clear about your outcomes, the easier it will be to develop indicators that you can use to build your evaluation framework. Please pause the recording here and open the workbook for Module 1. Hopefully, you will now have a set of outcomes that you believe are realistic and relevant for your work. We are now going to look at outputs. Outputs are the things you are going to do or produce that will achieve the desired changes. When you are outlining your outputs, keep the following in mind. There needs to be a solid if-then relationship between what you do and the changes you expect. Include details about who you will reach, what you will do, where, when, and how it will happen, and targets for numbers to be reached and frequency of activities. Outputs also include products, for example, people trained or qualified, guidelines, reports, campaigns, and policies, or even new processes and structures that could be evidence of your achievement of organizational or process outcomes. Here is an example. We will run a social media campaign twice a year, including the voice of those with lived experience of the issue. We will offer 2 sessions of storytelling training to service users and will make 6 short videos per year. Our target is to reach X number on Facebook, LinkedIn, or Instagram, whichever is your preferred social media platform. Each of these elements is easily measurable through your standard monitoring processes and provides evidence that you are implementing your service as intended. So, to your next activity. Using the Outputs column in Template 3, please develop a set of outputs that relate to the outcomes you have already identified. Remember the if-then relationships. Please pause the recording here and open the workbook for Module 1. When you come back, we will test the theory of change between your outputs and your outcomes. Here are a set of questions to ask yourself to check if your theory of change stands up to scrutiny. Ideally, you would be completing this whole process with your team. It is particularly useful to test your theory of change with others when you take it into a real-world setting. Ask yourself, am I confident in my hypothesis that the activities outlined will achieve or at least contribute to the desired outcomes? How will that change happen? What is the mechanism of change? What evidence do I have that the change is likely? Is the theory of change understandable? And is it achievable in the time available? Do I have activities that do not link to any of my outcomes? If the activity is necessary, develop an associated outcome. Do I have outcomes that do not have any associated activities? Change will not be produced without relevant activities. Do I have the spread of activities right? Are there too many activities focused on just a few of the outcomes? Is the theory of change contested within the team or stakeholder group? Lack of agreement will likely impact on its success. Take a few moments to think about these questions and check whether there are any gaps or weaknesses in your theory of change. We are now moving on to inputs. Depending on whether you're using the logic modeling process to design a new service or to review an existing one, you might be focused on the resources you will need or the resources you already have, or both. Inputs can include staff, volunteers, and partners, not forgetting service users, without whom you have no service, funding and buildings, insurance, even the tea and coffee, and the technology, support structures, and information systems you need to keep the service going. In fact, inputs are everything you need to be able to do the things outlined in your output section and provide back-of-house function. Take some time to put as much information as you have into the inputs column, paying attention to costs that may be hidden, like your insurance or head office payments. So, now we come to the question of how you know that you have implemented your service or policy well, and that change has taken place. We are going to look at indicators. Much of this really does come down to you knowing what change would look like for your target group, whether the change efforts are aimed at your service users, staff, or those in receipt of the policy you are implementing. When collecting information about the implementation of your service and the difference your work has made, choose targets and indicators that can provide signs of progress or achievement. This is not a list of how you will collect information. Indicators demonstrate the evidence of change. Let's explore that a bit further. Indicators can measure the degree to which outcomes are being achieved. They can be related to outputs. What did we do? For example, training courses provided, or meetings held with policymakers or public health campaigns. They can be related to process. How well did we do it? For example, response times to measure reduction in delays, number of unique visitors to the website, or social media clicks to evidence increased reach. They can also relate to outcomes. Are people better off? For example, if the outcomes is reduced isolation, you might be able to measure activities, attendance at groups or courses, volunteering, or positive relationships. Some of these could be self-reported or observed by staff. Indicators do not always need to be quantifiable. They can be qualitative or quantitative in nature. They must be realistic, practical, and clear. For service evaluations, your staff and stakeholders are more likely to collect data when they can see the value of it, and they can see how it is used. What you measure may change over time. Some long-term outcomes will be challenging to measure, unless you have resources for longitudinal studies. A bit more practical advice. It might seem obvious, but your indicators need to be clearly linked to the thing you are trying to understand or measure. They need to be simple and easy to understand. It's important to only collect data that is relevant and important. Again, if the people who collect the data can't see it being used, they may be less motivated to collect it. Finally, the data needs to be available, accessible, and you need to have the resources available to collect it. An example of this is delivering services to support children's education and hoping to measure improvements in their educational attainment. This data may only be available at a whole school or countrywide level and not at the level of a class or small group. It's a good idea to think about how you can access the evidence you need. Using the Indicators column in Template 3, please develop a set of indicators that relate to the outcomes you have identified. You can also set indicators for measuring your outputs and process outcomes, if you have them. Remember that indicators are not a list of how you will collect the information. They reflect the evidence of change that you plan to demonstrate through numbers, observation, or self-reported views. Please pause the recording here and open the workbook for Module 1. You have now thought through each of the stages of the logic model and have tested your theory of change. You have your project on a page, which is useful for communicating your whole project in one visual. You also have the basis for developing an evaluation plan for your service, providing a focus for where you target your resources and what you measure. If you have signed up for Module 2, the training will focus on the following: what to evaluate at different stages of your work. Asking the right questions. That is twofold. It's the big questions you want to be able to answer from your evaluation, and it's also forming effective questions that your evaluation participants will be able to answer. Data gathering methods that will fit with your indicators. Qualitative and quantitative evaluation and choosing the right method for the situation. And finally, developing an evaluation plan that will work with the resources you have available and will answer your evaluation questions. Congratulations on completing Module 1 of the CES Evaluating Impact training program. This is a 4-part program. If you wish to take part in any of the other modules in this program, you can register on the training course homepage. Thank you for choosing CES training. We appreciate any feedback that will help us to improve this product.